Hi, everyone. Lori Marie here from the Mental Health Association of Rhode Island. Did you know that our mental health can affect the health of our pelvic floor? This is particularly true for women. And in honor of International Women's Day, we will explore this fascinating connection. And that's why I'm delighted to welcome Dr. Chelsea Savigny, a pelvic floor physical therapist who's here to answer all our questions. Welcome, Dr. Savigny.
Hi, Lori Marie. Thank you so much for having me here.
Very excited to dive into this really interesting conversation. I was just fascinated when I learned about this connection, and I'm really grateful that you can spend some time with us today. Could you maybe start by talking a little bit about your background?
Absolutely. So I graduated with my Doctor of Physical Therapy in 2017 from URI. And everyone comes out with their doctorate now where we can generalize in orthopedic and neuro and pediatric and all these different wonderful specialties. Those of us who want to pursue pelvic floor physical therapy require some extra certification. So I have my level 1 and 2 certification for pelvic floor PT through the Herman and Wallace Institute as well.
Wonderful, wonderful. Let's start with the basics. Can you talk a little bit about what is the pelvic floor and what purpose it serves in the human body?
Absolutely. The pelvic floor is my favorite group of muscles. It is the group of muscles that are layered inside of our pelvis. It kind of makes this hammock of muscle and connective tissue across our seat bones and our pubic symphysis to the tailbone. Its main functions are really to help with supporting our pelvic organs like our bladder and bowel and uterus inside of our pelvis, and provides sphincter control to close the urinary and bowel tracts to provide continence, and it helps stabilize our trunk for core strength and for breathing.
Wow, who knew this little group of muscles was doing so much for us?
They're the most important muscles.
I know women have a pelvic floor. What about men?
I love this question. I think this is a fantastic question. Everybody who pelvis has a pelvic floor. And I think that the misconception from a lot of this, or they can't do anything with it, but in actuality, everyone who has a pelvis has a pelvic floor. Now, I myself happen to only treat people who have vaginas, but there are physical therapists out there who treat people with penises and people in the LGBTQ community as well. What's really surprising about across all different people and shapes of pelvises is that their anatomy is surprisingly so similar. It's all the same structures. It's just organized and shaped differently around the pelvis.
Interesting. Very, very interesting. So how might one's mental health affect our pelvic floors?
This is a huge question, and I tend to find in my own practice that a lot of patients really get best when they're also under the care of a mental health professional. I think a lot of this comes from a long history of not having the pelvic floor looked at as an important piece of our daily functioning and just an important piece of our physical health. So people with pelvic floor dysfunction, because it's not subjects that are really talked about or normalized in their normal community, or even necessarily in healthcare, it can be overlooked at times. So these people are built up with problems that they may have internalized. They think that they're alone, the only ones are having this issue, or it just can't be addressed. And they're can go by years feeling like they just have to deal with this is the way their body is, when in reality, it can be helped. And there's a lot of shame that comes with having issues amongst their pelvic health, right? Like we don't talk about our bowel and our bladder function and our sexual dysfunctions and things like that. And that can then really lead to problems with our normal social and recreational function, just getting through our day-to-day and planning our trips to the bathroom or being stressed about our sexual lives and things like that. And actually, the research shows a very high correlation between severity of depression and anxiety with severity of pelvic floor dysfunction.
That's so interesting to learn about. I've never had a medical or mental health professional inquire about the health of my pelvic floor. And I'm someone who has lived with and received treatment and services for depression and anxiety. So this is all very interesting and new to me. It sounds like, you know, how we have a sore neck or tight muscles in our neck or in our shoulders or in our back when we're feeling anxious and chronically stressed. It sounds like that can also happen in the pelvic floor muscles as well. If you're holding tension up here, you're probably holding tension down there too.
That's exactly correct. And there's no one else in your life to teach you, like, this is what you should be doing with your pelvic floor. This is how to relax it. This is how to contract it. Absolutely. It's a very high place where we tend to carry and hold tension, and a lot of our problems kind of can manifest as physical issues here. And to your point, I think that it's how the healthcare industry is evolving and becoming more normal, but there are not a lot, necessarily all doctors are asking about these kind of problems. And it may feel up to the patient to pursue treatment themselves for it. And people do not always know that this is a thing that they can be treated for.
Yes, I think every medical professional and mental health professional should have your number on speed dial and your business cards to give every patient, every client.
I appreciate that. And I think we should all collaborate on this too.
Yeah, I mean, I would take, you know, it's a holistic approach when you're talking about the body and the mind connection. Yeah. Are there factors other than
Absolutely.
mental health that could affect a person's pelvic floor health?
We could probably go on about that all day. The big ones, honestly, especially when we're talking about for International Women's Day, is childbirth history. Certainly, some people experience more or less dysfunction, and that can be dependent on how many children they've had, the type of childbirth they had, any complications during the pregnancy or delivery. In other countries, it's actually very commonplace to receive a pelvic floor physical therapist during pregnancy and postpartum. That is not the case in this country, unfortunately, but it should be. And a lot more, thankfully, women are finding that to be true, that it's really helpful. But certainly childbirth history, and in the vein of women, also going through life changes in the hormonal phases that happen. A lot of menopausal women can experience pelvic floor dysfunction with the changes, the normal changes that happen. But also certainly family history plays a factor, surgical histories going through the pelvis or abdominal wall, GI issues, any history of constipation and straining causing pelvic floor dysfunction. Certainly trauma can be a very large aspect, including any sexual traumas or just physical injuries or violence. Excessive lifting and stress and too low of activity levels. Those are all things that can factor into our pelvic floor. People who are smokers have chronic coughing, that can factor in, and a high correlation with like back pain or chronic pain.
My goodness. Oh my goodness. Can you describe any signs or symptoms that someone should be aware of? And if they have them, perhaps they should reach out and talk to a pelvic floor physical therapist like yourself?
Absolutely. I recommend reaching out to a physical therapist for pelvic floor dysfunction if you are recognizing really any of these following problems in the urinary, bowel, or sexual health. So with urinary, a lot of people might experience leakage with laughing, coughing, sneezing, lifting, things like that. That's really common. People might be getting more like high urinary urges that are making them run to the bathroom and they may not make it in time. More of an urge incontinence issue. They might be going very frequently to empty their bladder, and that can be pelvic floor dysfunction. Any bladder pain or irritation or feelings of chronic UTI-like symptoms, that can be pelvic floor. Certainly people with pelvic organ prolapses, which is going to manifest as like a heaviness or a pressure in the vagina or the bowel region. Any pain with any vaginal or rectal insertion at all. That can be from sex, from exams, or from even inserting a tampon. Those are all highly indicative of pelvic floor dysfunction. Any hip or back pain that is not getting better in traditional physical therapy, highly correlated to have pelvic floor dysfunction. And if you have a history of bowel dysfunction like constipation and chronic straining or bowel leakage, all excellent reasons to see a pelvic floor PT.
Well, it's good to know that there's someone there who can help us. Is this common among women and men?
Great question. Yes. Specifically, the statistic for women is more readily tracked. And right now, the statistic is that 1 in 3 women at some point in their lives will experience pelvic floor dysfunction. A third of all women is a very high statistic. And we suspect that's completely underreported because people may not know that what they're experiencing is a pelvic floor dysfunction, or they don't talk about it.
Wow. Wow. What are some tips that we can do to maintain our pelvic floor health?
So I would say the first number one trick is to stay hydrated.
Ah.
Staying hydrated is going to be really important for your normal mucosal tissue functioning and for your bladder functioning and for your bowel functioning. I would say keep maintaining good pelvic hygiene and sexual health habits to reduce any risk of infections or irritations or anything in that sort of vein. Using a stool underneath your feet when you're sitting on the toilet, especially for bowel movements, will reduce the need for straining, and that can be really important in daily bowel functioning. Avoid just going to the bathroom to urinate, the just in case peeing, we call it. Try to avoid that. Just let your bladder fill when it's ready to empty it then. With the more often we go, the more likely we are to develop a pelvic floor dysfunction, especially if your bladder is not fully full and ready to empty. And honestly, for people, like, it's not all just about Kegels. Like, it's not all about Kegels, which is the contraction of our pelvic floor muscles. Some people really know how to do them correctly, and a lot of people don't, because there may not necessarily be someone in your life telling you how to correctly perform them and when to perform them. Some people need to do more, and some people need to do less and learn how to relax their pelvic floor and release some of the tension that they're holding on in there. So it's not all about Kegels. Do not just do a million and hope that your pelvic floor dysfunction goes away. Just see a pelvic floor therapist if you really have a question about it. But really, the big things is to exercise and stay active, keep a healthy lifestyle, and be mindful about these problems and noticing if an issue is arising, you need to bring it up to a provider until they find you a pelvic floor therapist.
Do insurance companies cover the treatment and services of a pelvic floor physical therapist?
Yes, great question. Absolutely. It's covered just like normal physical therapy services. And in Rhode Island, if you don't have Medicare or neighborhood, you can even use it direct access. You can go right to your physical therapist first and find out if this really is pelvic floor dysfunction, if it's something in our wheelhouse to treat. A lot of it is. You can just call us directly first.
Dr. Savigny, is there anything that you would want to bring up, anything I haven't asked about yet that you feel is important to share?
The only thing left I wanted to say was that I just thank you for bringing this to the attention of other types of providers as well. I think it is such an important topic where, especially in the pelvic floor world, the mental health and the physical health world really need to collaborate on this in order to best help the patients. I always find that my patients who are doing the best are really being also seen in any kind of mental health therapy as well. And I want everyone and PTs out there. So ask your provider or.
Oh no, Dr. Savigny, I think you froze. Oh, there you go. Can you just repeat those last few sentences? I think you might have frozen.
Sure. I was saying that it's really, these issues can be so common, but never, they're not normal. They're not how you have to function in your day to day. And things like going to the bathroom and maintaining a sex life is functioning. And therefore, having a problem, bring it up to your provider so that they can find your PT. And we're always around to help.
Sounds terrific. Thank you so much. If folks want to reach out to you with questions, how can they find you? And I'll also put your contact information in the newsletter.
Great, thank you. So you can find me at our Warwick location at what is currently called Performance Physical Therapy, but you will see us evolve into High Bar, and you can look for me at our Centerville Road office, and we have other pelvic floor PTs around too.
Thank you so much. And again, this is Dr. Chelsea Savigny. We'll put her contact information in the newsletter as well. And thank you so much, Dr. Savigny, for taking the time to educate us. This is really interesting, and I hope it helps a lot of people out there. Thank you so much.
Thank you for spreading the word and for having me. I really appreciate it. And all of us pelvic floor PTs super appreciate the shout out.
Thanks so much. You have a great day.
Ew.